University. And what's your name?
Stephanie.
Is it all right if I call you Stephanie?
Mm-hmm.
All right, Stephanie. So today you're here for a musculoskeletal assessment. I want to remind you that everything is completely confidential. I won't share anything unless it's with the healthcare team. It'll probably take us around 7 to 10 minutes. And if you have any questions or concerns or you feel any discomfort at any time, just let me know and I'll try to address them for you.
Mm-hmm.
Do you have any questions before we begin?
No.
Okay, so first if I can ask you to just stand up and walk across the room for me.
Mm-hmm.
I'm looking for heel to toe motion, and I'm looking that your arms are going opposite from your leg motion. All right, so now we'll just talk a little bit about your health history, so if you want to take a seat. Okay, that's probably, just down, let's pretend I'm sitting. All right, so Stephanie, can you tell me about your age? How old are you?
I'm 17.
All right, and do you have a job?
No.
No, so just a student?
Yes.
Or, all right, and what are you studying?
I'm studying nursing too.
Oh, all right. So can you tell me a typical morning, your activities? You get up, do you wear your clothes?
Yes, I get up, get dressed. Yes, I wear clothes. Yes, I get up. There's no issues, no pain. Or brush my teeth, shower, no problems.
Any problems with daily activities, walking around from class to class, standing up, maybe buttoning or zipping your clothes?
No, I don't feel any tugs or pulls or any problems with any of those activities. Walking is comfortable, running is comfortable.
And how's your nutrition intake? Enough calcium, protein, carbohydrates?
Calcium levels are good. Protein could probably be better since moving on campus. But nutrition overall, I eat 3 meals a day.
All right. And is your elimination pattern normal?
Mm-hmm.
And how's your sleep pattern? Do you sleep enough?
Yep, about 7 hours.
7 hours a day?
Mm-hmm.
And your exercise, do you do anything?
Inconsistently, but yes.
That's nicer than that. What inconsistent exercises do you do?
Running.
Running, and how frequent?
Well, since exams, since life's gotten stressful, but yes, we'll continue.
You feel about that. All right, so now we're just going to go into your family health history. So do you have any occurrences of arthritis, osteoporosis in your family?
No.
And do you have any...
Oh, arthritis, yes, but osteoporosis, no.
Who has arthritis in your family?
Mother and grandmother.
And have you felt any joint pain or anything related to that
No.
recently? No? All right, so it looks like we're ready to begin. Do you guys want to do upper or lower?
Both.
Upper first. Upper first.
Upper first? Okay. So if you could just stand up for me. This is the part that you have to do for everything, whether you do upper or lower, okay?
Okay.
So I'm going to face your anterior side. I'm looking for your plumb line, which means that your nose is above your shoulders, which are above your knees, which are above your toes. That's the plumb line, okay? I'm looking that your shoulders are equally aligned and that your hips are also equally aligned, that your toes point forward when you stand up and your arms are at the side. Now facing you lateral or side view, I also see the plumb line. I see that your ears are above your shoulder, are above your toes. Posterior, I'm looking at your backside. I see that you have the normal lordotic and kyphotic curvatures of the spine. I see that you have your shoulders are equal, your scapula is equal, your gluteal folds are equal, and that your ankles are equal as well. All right, so now I'm going to start at the back, and I'm going to start to inspect and palpate. So with palpation, I'm palpating your trapezius muscle. Now I'm going through your spinous processes. So what you do is you go.
Is neck first or is the back?
I was thinking, what about neck and head?
Well, this you have to do for everything. This is not upper body yet. This is what you have to do for everything.
Yeah.
Eventually
Yeah, I just thought that neck
I
was
thought neck and
first.
head was everything.
Yeah.
Well, you can, but
Okay.
because it's the spine anyway, and I just looked for her curvature, I might as well just go straight to the spine instead of turning her and then turning her again. Right?
Okay.
So
I
I'm
think that one's a little bit of preference on what you want to do first.
Yeah, what
but
you want to do first.
as long as you cover it.
So I'm palpating the spinous processes, making sure that I don't feel any deformities or masses. Now your paravertebral muscles, that they're symmetrical. Is there any pain? No. I feel no deformities, masses, so that looks normal. All right, so can you face forward, please? So now we're just going to do some exercises with the spine. So can you bend forward, which is flexion, and back, extension, a little bit back, hyperextension. That's normal. Was there any problems with any of those?
Nope.
Okay, so now you're pretty much done the spine. So now you move to
Do you do
upper and
lateral
lower.
or no? Or is that?
Oh, you're right. Maybe we should. Yeah. All right. Well,
just to make sure that
all
they're
right. So
actually
can we
having
do
their-
lateral bending? So to the side and then to the other side, and now rotation. So we're at the other side. Okay. So now you want to do upper body or?
Yeah, let's
Let's
start
do
off with upper.
Both,
Or
upper and lower.
Is neck considered upper or is it considered
It's
lower?
everything.
Well, the neck and spine you're gonna. So like we just did the trapezius and below bust. So I'm not gonna
that's
really.
considered neck.
And then
Yeah.
are you going to do range of motion for the neck flexion?
Yeah.
extension?
Well, first I'll just go over here and then like the clavicles, and then we'll do the neck. Okay. So now facing your anterior side, I'm going to be assessing your neck. So again, I'm just feeling for the trapezius muscles, and I'll go down to the clavicles as well. I'm looking for deformities, masses, or any joint pain that you have. Now let's do range of motion for the neck. Let's have flexion or forward, extension or back. Now moving to the side, rotation to the other side, rotation, lateral bending, bending to one side, the other side. Okay, so now we're going to do resistant motion. So you're just going to follow the motion against my push. So if we could have rotation, so push, good, rotation, push. There's also flexion extension, but that's really awkward with the neck, so
forward.
I'm not going to do that.
For
Yeah.
Xana,
And I don't, that's, no, don't do that. Okay, so now we'll go to the arms and the shoulders. So I have your deltoid over here, going along your humerus. Again, I'm feeling for any bony prominences, any deformities. Going around your forearm now, and on your elbow, the olecranon process. This thing, make sure you do that. They like that. Between my thumb and my index finger, olecranon process, I think. So you go like this. So you basically take the piece of skin and you just go funny around it, just because they like that. Now I'm going down your forearm. Is there any pain?
No.
Now I'm at your carpals. Now your metacarpals. Now I'm going to do each finger, your phalanges, your interphalangeal joints. That's when you go to the side like that. I'm feeling if there's any fluid accumulation, any deformities, or any masses. Everything seems fine. Alright, we'll do the other side and then we'll do range of motion. So again, I'm just going along your deltoids, around your arm, the olecranon. Okay, we're going to have to find out how to say that.
It's olecranon.
Olecranon?
Mm-hmm.
Thank you. And down your forearm, your carpals, your metacarpals. Do it properly, not like I'm doing it. Interphalangeal joints in your phalanges. There's no bulging or bony prominences or fluid accumulation. So everything looks fine. So now let's do our range of motion. So abduction, adduction. Now let's do the same thing but resist passive motion. So you can push down, please. Okay, now push up. Okay. And now let's have flexion. So bending forward, extension, moving them back to normal. Now let's do the wrists. We have hyperextension and back to normal, extension, flexion, sorry, back to normal. Now let's do our fingers, adduction, abduction. Now with your,
Opposition.
sorry, did I do it
position?
wrong? Thank you. Radial, what's it? Radial deviation, ulnar deviation. Is there any pain with anything? We did everything for the.
Do we have to do resistance?
Yeah, you should have done.
We'll do resistance, but we did all the range of motion, right?
And then we do
Okay.
this.
Opposition. So, what would you do? Is like fingers, thumb?
Yeah.
So I guess, how would you guys do passive motion for this? So pushing, I guess?
For what?
Like for passive motion?
Function, it's like you put it here.
For your fingers.
Oh, for fingers, it's like this, and you put them and you go squeeze.
Oh, okay. So you want to do that? All right, passive motion. Now, could you go against my resistance and forward too?
Should you be doing this on like a table?
You
So
could,
it
yeah.
doesn't like flop
Yeah, we'll
around, right?
probably, and pronation and supination, maybe we could, no, we can do it here. So pronation, put them down, supination, put them forward. Was there any pain with anything we did? No. So we pretty much did upper body.
Yay, now let's do lower.
Okay, does anyone want to do lower?
I can
No.
stop it down.
This is what I
keep
do.
doing it.
Keep going, keep going.
Lower? Is this helpful?
Yes, it is.
Very. Yeah.
Okay.
Thank you
Always
so
helpful.
much.
You're amazing, Marina.
Oh, no, thank you.
Or are we gonna do hip bending first? Or?
How do you guys like doing the lower body? Like, do you guys find that it's easier when the person's on a dummy? I mean, on a bed. Yeah,
Prompts.
Yeah.
probably. Okay, what could we do? We could do hip. Yeah, just let down.
Okay.